Hi, and welcome to our playroom. My name is Stephanie. I'm a mom to a 3.5-year-old and a 1.5-year-old. I'm also currently 31 weeks pregnant with baby number 3. I've also been breastfeeding continuously, meaning every day, multiple times a day, since my 3.5-year-old was born. If you do the math, that means I've now breastfed through 2 pregnancies, which is what I want to talk about today. What's safe when it comes to breastfeeding while pregnant, what's not so safe, what's comfortable, what's uncomfortable, what are some of the benefits and cons, all of that good stuff. Now, I'm not a lactation consultant or a medical provider. I'm just a mom who's gone through this twice and learned a lot along the way. If you're interested in hearing my perspective or asking about my experiences, then yeah, stick around and let's chat. Okay, so first of all, let's get it out of the way. Is it safe to breastfeed while pregnant? The short answer is yes, it is safe to breastfeed during pregnancy. The slightly longer answer is I am not your doctor and you should not take medical advice from strangers on the internet. Basically, assuming you have a low-risk pregnancy, it's probably safe for you to breastfeed while pregnant. However, you should definitely consult with your OB or your midwife or whoever you're consulting with for medical advice during your pregnancy, just to make sure. There may be certain medical conditions that would make it unsafe for you to breastfeed while pregnant. Potentially, if you're carrying multiples, your doctor would advise you not to breastfeed. So whatever your individual situation is, just run it by a medical health professional before you continue to breastfeed through pregnancy. The last thing I'll say about health and pregnancy and breastfeeding is just to pass along some advice that my midwives gave me. And that was to wait at least a year between pregnancies before trying to get pregnant again, especially if I was going to be breastfeeding and maybe wanted to breastfeed through pregnancy. They gave me this advice for 2 reasons. One, breastfeeding and pregnancy are both really demanding on a woman's body. And by demanding, I mean they're very nutritionally demanding. They require a lot of calories to support. They require a lot of macro and micronutrients to make sure that you're healthy, new baby is healthy, growing baby is healthy, existing baby is healthy, everything. It just requires a lot and it's taxing on a woman's body. So allowing for a year between pregnancies just gives your body plenty of time to recover, to replenish your supply of some of those macro and micronutrients, think folic acid, iron, other things that might have been depleted between one pregnancy and the next, just to make sure that you're in the best possible physical condition before going into a second pregnancy. The other reason my midwives gave me this advice was because breastfeeding while pregnant is not always super comfortable. It's not always safe, as we touched on already, but it's also just not always comfortable and not always something that either mom or the existing kiddo wants to continue. So if you wait until you're past that 1-year mark, it's just easier to transition your kid to other milk supplies or sources like cow's milk or oat milk or almond milk or whatever kind of milk that your family drinks. After that 1-year mark, it's easier to incorporate that into their diet and replace one or more or all of your breastfeeding sessions with another source of milk. The other thing is after that 1-year mark, your kid is probably getting most of their nutritional needs met through their solid food intake. And so again, if you're not able to or you don't want to breastfeed for whatever reason, then your kid is not missing out on a major source of nutrition. So with all of that health stuff out of the way, let's talk a little bit about what pregnancy means for your breastfeeding journey and particularly your breast milk supply. So the hormones that spike during pregnancy are not conducive to a healthy, robust breast milk supply. In particular, during the first trimester of pregnancy, progesterone spikes, and that is going to decrease your breast milk supply. Again, something to remember is that as your kiddo, your already born kiddo, your 1-year-old, your 6-month-old, however old your existing kiddo is, as they grow older, they're going to need less and less breast milk. This is doubly true if you've kind of reached past that 1-year mark. They definitely don't need as much breast milk as they did at 4 months and 5 months. So if your breast milk supply is decreasing, that's not necessarily a problem. Your kiddo might be okay, especially if they're getting their nutritional needs met through other food supplies and other milk sources. But it is something to be aware of that your breast milk supply is going to decrease. Depending on how old your kiddo is, you may or may not want to take steps to keep your breast milk supply up. This could include like drinking a mother's milk tea or changing your diet to incorporate foods that are going to promote a stronger breast milk supply. I never did any of that during my pregnancies. I kind of just let my breast milk supply be what it is. I was 15 months postpartum when I got pregnant with my second, and then 14 months postpartum when I got pregnant with my third. So in both cases, I felt that my kids' nutritional needs were going to be met, and our breastfeeding journey was really still in play because we were enjoying the bonding and sort of the like socio-emotional aspects of breastfeeding, more so than really focusing on meeting nutritional demands and caloric demands through my own breast milk supply. So I just kind of let the supply be what it is. But again, my kids were older, and thus I had a little bit more leeway in that. If you get pregnant really quickly or in rapid succession and you've maybe got like a 5 or 6 months old and you're trying to breastfeed them while pregnant, then managing your supply may take a little bit more work. This could mean breastfeeding more frequently, pumping between feeds, or again, taking supplements or supplementing your own diet with something to help boost that supply. The other thing to note when it comes to breast milk supply during pregnancy is that your breast milk is going to change. So somewhere between maybe the 4th and 5th month of pregnancy, your breast milk is going to change from that white, milky, looks like you could have bought it at a grocery store almost, breast milk, into colostrum, which is that liquid gold, yellow, very viscous, very high density, high nutrition, high calorie colostrum. It's the first milk that your baby ever gets from your boob. So right around that 4th or 5th month mark, your breast milk is going to change. You'll notice it. It's no longer going to be white. It's going to be back to sort of that like yellowy stuff. And most importantly, your older kiddo is going to notice. Colostrum tastes different than the other breast milk. There's not as much of it. So your body is producing colostrum, but they're not producing the same volume of colostrum that they would be producing for that white liquid milk. So your toddler is going to notice that change. They also may not like that change. So it's at this point that some older kiddos might choose to wean. They might say, ugh, I've been getting less and less of this stuff lately, and now it's changed and it tastes different and I don't like this change. And so I'm just going to be done with this nursing. I'm just going to drink my sippy cup of milk because it's easier and it has a consistent taste and I know exactly what I'm getting. Just something to be aware of, that some kiddos do choose to self-wean when their mom's breast milk supply changes during pregnancy. Neither of my kiddos decided to self-wean, but both of them did definitely notice the change, and they would kind of give me a look of like, what is this, Mom? This is not what I had yesterday. I don't necessarily like it, but I'm going to power through it. And then after like a week or so, they were just like, okay, yeah, this is my new normal. I'm fine with it. So your kiddo might also fall into that category where they kind of look questionably at the change in the milk, but then they just get over it and roll with the punches and continue to breastfeed as normal. So we talked a little bit about whether it's safe. For the most part, yes, but obviously there are exceptions to every rule. And we've talked a little bit about the fact that pregnancy will decrease your breast milk supply and also change the quality of your breast milk. Now let's talk a little bit about what it's actually like to breastfeed through pregnancy. It's not always super comfortable. If you are one of the lucky women who is able to breastfeed through pregnancy without any sort of discomfort or negative symptom, then I love that for you so much. That is amazing. I've had 2 wildly different experiences, and I think that gives a good illustration of the range of experiences that can exist. Obviously, every woman's pregnancy and every woman's breastfeeding journey are different, and so I would expect your own experience to be your own and be different from everybody else's. There might be similarities with other women, there might be things you and I have in common, but your journey could also be your own. I hope for you that your breastfeeding journey is one that is blissful and easy and comes with no discomfort of any kind. That has not been my experience, but I want that for you and I want that for every woman. That is like the ideal scenario. So for me, I became pregnant with my second kiddo when I was 15 months postpartum with my first. So my son was 15 months old when I found out I was pregnant with my daughter. During that pregnancy, I suffered from a lot of morning sickness and nausea. I suffered from that for almost the entire pregnancy. But for the first 6 months, I would say that breastfeeding was an automatic trigger for throwing up. So basically, anytime I put my son to my breast, within 30 seconds, I was throwing up in a toilet. I eventually just managed it. I would just start nursing him near the bathroom. We had a little bathroom he has a little bathroom off of his room. So we would just nurse kind of like near the edge of his room, near the bathroom. Within like a couple of seconds, I would start to feel the nausea growing, and I would just say, oops, 1 second, mommy will be right back. Pop him off the boob, go throw up. And then after I'd clean myself up a little bit, come back and we would nurse. Sometimes my husband would entertain him. Sometimes he would just like play with trains or trucks. Sometimes he would be really sweet and rub my back, which was really kind and nice of him, and totally reflective of his like loving heart. But yeah, 6 months without fail, breastfeeding led to vomiting for me. It was manageable, but not always super comfortable. Obviously, it was not great. With this pregnancy, so I'm currently pregnant with my third. I found out I was pregnant when my daughter was then 14 months old. So I was 14 months postpartum when I found out I was pregnant with my now third baby. I have not had a lot of nausea throughout the entire pregnancy, but I've definitely not had any nausea triggered by breastfeeding. Instead, the pregnancy symptom that has been aggravated by breastfeeding is breast tenderness. So I've had a lot of pain and discomfort while nursing. I didn't experience this the first time around, maybe like a little bit or like for a couple of times. I was like, oh, that's not great. Let's try a different position. But after that, I didn't have any problems nursing my son while I was pregnant with my daughter. This time with my daughter, every single time we nurse, no matter kind of like where we start or what position we try, it's uncomfortable. Sometimes it's downright painful and I have to pop her off and just say like, mommy can't continue right now, we'll try again later, in which case I'll just offer her maybe like a cup with a straw with some other kind of milk in it, if she's really hungry, or we'll just do some other sort of like bonding comfort thing. Maybe I'll just like hold her and rub her back, depending on why we're nursing in that particular moment, whether it's because she's thirsty and wants something, or most often it's just because she like wants mommy's attention, and she can get that in a variety of ways. So yeah, lots of pain and discomfort this time around. We often have to switch positions multiple times during a nursing session. Occasionally I can find a groove where I'm just like, okay, this position doesn't hurt. But yeah, it's definitely been more uncomfortable. The other thing that I've experienced this time, which I, again, didn't when I was pregnant with my second kiddo, is maybe like 1 in 10 breastfeeding sessions, I will just be filled with the kind of like revulsion for the act of breastfeeding itself. The nearest way I can describe it is sometimes when you're pregnant, you like walk into a room and you smell something, and maybe it's something you've smelled 100 times in your life, but in this moment or on this particular day, it's just like the most disgusting thing you've ever smelled, and you never want to smell it ever again. That's kind of how I feel about breastfeeding. Again, not every time we nurse, but it happens often enough that it is impactful and I notice it. It'll just be kind of like a revulsion for the whole activity. I'll be like, ugh, I don't want to be touched in this way. I don't like this. This feels gross. Like I can feel my milk let down. And that in itself is like kind of like a revolting feeling. Pregnancy is weird. And sometimes the symptoms you experience with pregnancy are super weird. And in this case, this is one of the things that I'm experiencing, like a random revulsion for breastfeeding. I don't know. We work through it. It's fine. We get by. With my daughter, I definitely tend to cut nursing sessions shorter than I ever had to do with my son. Again, like with the nausea, it was pretty easy to manage. It'd be like on, off. Now we can nurse for however long you want. With my daughter, I tend to cut nursing sessions shorter, either for my own discomfort or just because I get like the ick factor too hard. And I'm like, ugh, I need to stop this. This feels gross. The one experience that I've had consistent between the two pregnancies, and I think this is just like a physiological reaction that any woman's body would experience in a similar scenario, is the increase and the intensity of Braxton Hicks contractions. So I don't know how widespread this knowledge is, but nipple stimulation is considered one of the things you can do to bring on labor, and breastfeeding is obviously a kind of nipple stimulation. So as you get later in your pregnancy, I'm currently 31 weeks pregnant now. I think my Braxton Hicks started this time around 28 weeks. Whenever I nurse, 9 out of 10 times when I nurse, maybe not every time, I get Braxton Hicks contractions. So just like the tightening of the uterus, the sort of like practice contractions for labor. This happened during my second pregnancy when I was nursing my first kiddo, and it's happening now. I was convinced at the time that nursing my son was going to send me into labor with my daughter during my last pregnancy. I was like, these contractions are so consistent and they come so strongly when I'm nursing him, and these are just the practice ones. Like, I'm convinced breastfeeding is going to put me into labor. It didn't in my case. I went into labor naturally in the middle of the night, hours after I had last nursed my 2-year-old. So in my case, that didn't happen, but it's something to be aware of, and it could certainly happen for you. I have no idea. Maybe this time with third baby, the contractions will start during a nursing session, and maybe they'll just never stop, and nursing is what will send me into labor. I wouldn't be surprised. The Braxton Hicks contractions are noticeable, and they're pretty strong when they're brought on by breastfeeding, in my experience. So yeah, something to be aware of. I think that is probably one of the more universal experiences for a woman to have if she's breastfeeding while pregnant, especially breastfeeding in that third trimester, and especially that late third trimester. So again, just something to be aware of. So given all that I just told you, nausea, pain, discomfort, occasional revulsion, and then Braxton Hicks contractions, why would I continue to breastfeed through pregnancy? Or why would anybody? If that's just like what's on the table, and there's more symptoms that you could experience beyond that, then why would anyone continue to breastfeed? The answer to that is going to be super personal and super individual. I can tell you that for me, I continue to breastfeed because I really enjoy the sort of like social, emotional bond that it gives me with my older kiddo. I love that when we breastfeed, we're able to connect together. Oftentimes my daughter likes to breastfeed like after she gets done from school and she comes home, she wants to sort of just like reconnect with me at the end of the day. Same thing when she wakes up first thing in the morning. The first thing she does is run to me in my room, and she wants to nurse. These aren't like long nursing sessions. She just kind of wants to like connect and bond and hug, and it's just like a beautiful moment that we can share. The other thing is I find that nursing is a really great emotional regulation tool to keep in your back pocket. So toddlers can have really big feelings, and teaching your kids to manage those really big feelings is a huge part of being a parent to a little one. Occasionally, feelings just get away from kids, and for my kiddos, at least, if I'm able to offer them milk and an opportunity to breastfeed, it's the easiest way for them to come back down to like a more stable emotional state, where maybe their like cognitive brain will start working again, and they can actually think and talk and like explain why they were upset over whatever thing was upsetting them. So yeah, just in addition to all of the nice bonding we get for like, oh, I haven't seen you in a while, let's nurse and reconnect. Just being able to offer my kiddo the opportunity to nurse when they're having their really big feelings and they need to calm down, and they need especially to feel, I feel safe and I feel secure and I feel like my mom is here for me. Nursing allows me to do that in a way that no other thing I found as a parent does. So that's another one of the reasons I continue nursing. The other thing to think about is that if you continue to nurse all through 9 months of pregnancy, then your newborn baby also gets a benefit. So as I mentioned, sometimes around 4 or 5 months, your breast milk supply is going to turn into colostrum. If your toddler or your older kiddo continues to nurse and drink that colostrum all the way up until the day that you go into labor, then when your newborn baby is born, there's going to be colostrum at the ready for them. They are not going to have to work hard to get your milk to come in or get your milk to supply to start producing in the volume that they need it. It's all going to be right there. Your toddler, who is bigger and older and has more muscle and more capacity to sort of like force your body to produce this milk, is doing all of the hard work, and your little one is reaping all of the benefits. So your little one is going to have all of the milk they could possibly want when they come out. They're going to plump up and grow amazingly, hopefully, and that is a really great feeling. So they're going to benefit from your older kiddo doing basically all of the hard work of getting your milk to come in and be there and be at the ready for them. The other thing that you have the opportunity to do if you nurse through pregnancy is to then tandem nurse. So this is when you nurse your newborn baby as well as their older sibling at the same time. I did this with my first and my second, and I'm planning to do it with my second and my third. So maybe I'll make another video about what tandem nursing is like and sort of the pros and cons of that, as well as the best positions and like general advice that you want to follow when you are tandem nursing. But tandem nursing is another really beautiful bonding experience, and it can help your two kiddos sort of bond together. There's something really beautiful about having a newborn on one side and your toddler on the other, and you're just sitting there as a mom with like your kiddos all right there. It's a really beautiful moment, and one that if you're able to experience it, I think you'll also find is both really lovely and like really, it like hits all the feels. The last thing I want to talk about is some of the best positions for nursing while pregnant. Obviously, again, this is going to vary by kiddo and by mom, but in general, as your belly grows bigger, your options for nursing become a little bit more limited, and there are some positions that are going to feel more or less comfortable. So I've done this twice now. I've kind of gone through all of the options, and I figured out these are my favorite positions, and I'll share those with you so that you can try them as well. Okay, now I'm going to demonstrate some of my favorite postures for breastfeeding while pregnant. Again, I'm currently 31 weeks, and as my belly continues to grow larger, these are positions that I'll be able to continue to use all the way up through labor and delivery. I'm going to use Poppy here in lieu of my toddler because I don't think kids should be exposed or exploited on the internet, and Poppy is, you know, got a little more junk in the trunk than my kiddo, but roughly about the same size when sitting down. So for the first posture, it's just like a side-by-side sitting position. I'll come to sit, maybe on my kid's floor bed, on my kid's play couch, and I'll invite my daughter to sit next to me. And then while she's sitting up, she can just easy access. This is the most comfortable position. She's not sitting on me in any way. There's no extra weight on my belly. If I get those Braxton Hicks contractions, I don't have to add the extra 25 pounds of a toddler sitting on my lap. Yeah, this is a great one. I love doing this. You can also lean back a little bit while you do it, make it a little bit more chill. But yeah, side-by-side sitting, that's nice. If you're also going to sit, you can bring your kiddo to rest on your lap. In this case, I asked my daughter, and I would ask your kid to spread their legs so that they're kind of straddling your belly, and then they can put their hands also on your belly, and again, easy access, both sides. This one's a little bit less comfortable because your kiddo is sitting on your lap. So if you start getting really bad Braxton Hicks contractions, or your little one is kicking really strongly, that can just be uncomfortable. Nursing can also sometimes make kiddos really sleepy, which is, again, one of the magic pills of nursing. But if your kiddo starts to get really tired, they're going to put more and more of their weight on you, which is just more and more weight on your belly, which might not feel great. But this one is pretty accessible and is one I also use a lot. The next one I'll show you is side lying, where you are laying down. So a lot of people will recommend side lying posture where your older kiddo is then also laying down. I don't personally like this because I find that toddlers are really mobile nursers, and they can kind of kick a lot, and they're not necessarily the most like, I'm ready for sleep and I'm just gonna curl up next to my mommy, the same way that like a newborn will. Instead, what I like to do is offer my toddler the chance to sit next to me, and then I'll offer them the breast of mine that is not next to the mattress or whatever we're laying on. So I'll offer them the more raised breast. And again, this keeps all of their weight off of me, essentially. This is my favorite posture to do in the morning when I'm still sort of like lying in bed and my daughter runs in and says, Mommy, 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 I want to nurse. Yeah, this is what we do. I lay down, she sits next to me, we nurse a little bit, then we switch sides, and then we go about our day. Finally, the last one I'll share, you can continue to do like a traditional, like I'm holding the baby, but instead of holding your kiddo like right up against your breast or against your stomach, like there's no space between my boobs and my tummy anymore. I can't do that. Instead, if your kiddo is old enough, you can kind of just like wrap them around, kind of like make them a C shape around your tummy, and then you can hold their head kind of like in your armpit or in the crook of your arm, which still gives them access to your breast. But again, you're keeping all of that weight off your stomach. You're not sort of doing like a crossbody thing. We're not actually really rocking the baby. We're just kind of like, imagine you're holding your toddler on your hip, and then you take both their legs and wrap them both around your tummy. So they're straddling your tummy like a C shape. My toddler will do this. She'll often like rub my belly at the same time, which can be nice and sweet of her. until her younger sibling starts kicking her, and then she gets mad, and it's a whole thing. But yeah, this is another one that can be accessible. I will often use this one in my nursing chair, just because a lot of the other postures like side lying are not accessible if I'm sitting in a rocking chair. Now, I think that's everything I wanted to share when it comes to breastfeeding and pregnancy. If there's anything I didn't touch on that you have questions about, then please leave those down in the comments below, and I'll be sure to read them and get back to you. If you have your own experience when it comes to breastfeeding and pregnancy, then I would also love to hear about that. So again, put it in a comment down below. I'll make sure to read all comments and reply to them. If you like this video, please give it a thumbs up and subscribe to my channel for more motherhood content like this. I also put out prenatal yoga videos at least once a week. So yeah, stick around, and I hope you'll find something on this channel that you enjoy. Thanks for joining me today, and I hope to see you in a future video. Bye.